Welcome everyone. Thank you for joining the NAS Provider Video Series. This series of 4 videos was developed to increase awareness and understanding of adverse childhood experiences, prenatal substance exposure, medication-assisted treatment, and the impact on infants and their families. The development of this public education series is the result of collaboration between state agencies and community partners. Trauma impacts the brain and causes long-term effects on a person's life. This is particularly true in the development of infants and adolescents. Our first video is presented by Dr. Danica Denton, a board-certified child and adolescent psychiatrist at Phoenix Children's Hospital, and Dr. Funda Bacchini, a board-certified child and adolescent psychiatrist and inpatient medical director at Phoenix Children's Hospital. This video explores adverse childhood experiences, or ACEs, and how the trauma associated with those experiences increases the risk for long-term physical, psychological, and behavioral issues, including substance misuse. Trauma can have real consequences on an infant's growth that last long past the development stage.
I am Dr. Danica Denton.
And I'm Dr. Funda Bacchini.
I'm a board-certified child and adolescent psychiatrist at Phoenix Children's Hospital, and I have a special interest in maternal mental health and infant mental health.
I am also a board-certified child and adolescent psychiatrist, and I'm the inpatient medical director at Phoenix Children's Hospital.
Today we're going to talk about adverse childhood experiences and how trauma changes the brain and the long-term effects that trauma can have in a person's life.
The Adverse Childhood Experiences Study, also known as ACEs, started at an obesity clinic in San Diego that was run by Kaiser. What they found was that even though everyone was losing weight, about half of the patient population was dropping out, and they wondered why this was. So they went back and talked to those people more in depth, and what they found was that those people that were leaving the study had childhood trauma and abuse. This piqued their interest, and so they paired with the CDC to look further into what was going on with these patients that led to negative healthcare outcomes. These things include sexual abuse, physical abuse, emotional abuse, physical or emotional neglect by a primary caregiver, or various types of household dysfunction, whether that be having a parent who was incarcerated, had a mental illness, used substances, your parents being divorced, or witnessing domestic violence against mom. Those were the ones that were looked at in this particular study. Now we know that there's many other adverse experiences in childhood, having racism, witnessing violence outside your home, living in an unsafe neighborhood, being afraid of deportation, or involvement in the foster care system are all potentially traumatic experiences for kids. So what happens if you have these factors? Well, if you have 4 or more ACEs, that results in multiple risk factors for chronic diseases or the development of those diseases themselves. These are things like obesity, diabetes, substance use, coronary artery disease, among others. If you have 6 or more ACEs, that can result to up to a 20-year decrease in life expectancy. So this is a big deal. What happens to us when we're kids and what happens to the kids that we see now has a huge impact on who they become as adults. In Arizona particularly, we have a very high percentage of kids with ACEs. In fact, we have the highest percentage of kids with ACEs of 2 or more, about 30% versus 21% on the national level. Kids in foster care have high ACEs, as you would expect, but by the time they are first presented to care, they usually already have 4 ACEs, and more than 90% of them have multiple ACEs. So who's most at risk? Well, those kids that are in care, but also kids in the LGBTQ community, intellectually disabled children, as well as those that are from economically disadvantaged homes.
So there are different types of trauma, and there are different consequences for each type of trauma. One type of trauma is bullying. Children who are bullied are often at risk to be bullied in the future. They often bully other children. This can lead to school avoidance and downstream effects, including decreasing academic performance. Another type of trauma is traumatic grief. You have to think about the event that occurred. How sudden was it? How traumatic was it? What is the child's understanding of the event? And you have to differentiate this from normal grief. Often in traumatic grief, the child will experience the event as scary. Their memories of the event are terrifying to them, and they will often have nightmares. These children will complain of intrusive memories. They can often seem numb. An important type of trauma is also community violence. Children who are in these situations are often in survival mode. They are in a constant state of fight or flight. They don't trust the environment around them. They don't trust the adults around them to keep them safe. So medical trauma is a very important trauma that is often missed. Up to 80% experience medical procedures as a trauma and develop symptoms of PTSD. This is incredibly important in children who have chronic diseases and who are undergoing multiple painful procedures. Also, refugee trauma is a very important trauma, especially in Arizona. Symptoms can vary depending on the developmental level, but it can lead to regression in milestones as well as somatization. Most children do not have a single solitary trauma. They often have complex developmental trauma. These traumas are often interrelational and one after another. This is often physical abuse and neglect. Complex developmental trauma affects the relationship of the child with the caregiver. It affects that ability of the child to attach to their caregiver. When we think about attachment teaches children how they're going to interact with the world for the rest of their life. So this complex developmental trauma will cause them to have difficulty establishing relationships later in life. They'll have difficulty with their caregivers, difficulty with friends, difficulty with spouses. Often when children have had complex developmental trauma, you will see that they have a heightened stress response. They're sensitized to stress. They will appear very emotional and overreactive to even very small stress. You can also see the opposite, which is dissociation. When children are very young and when they're traumatized, they often feel helpless, so they will go to kind of a safe space. You'll hear from parents that children looked zoned out or like they're not even there. This is important because early trauma and ACEs correlate with high-risk behaviors later in life: drug use, unprotected sex, heart disease, cancer, and early death. We know that trauma causes neurobiological changes in the brain, and the downstream effects of this are incredibly important, especially when you're looking at substance abuse. People with ACE scores are 2 to 4 more times likely to use a substance. And if you have 5 or more ACE scores, you're 7 to 10 times more likely to use drugs, to become addicted to them, and to inject them. ACEs also can lead to more chronic pain, which leads to opiate use and misuse. Parental ACEs and transmission of ACEs is very important because here we're talking about prevention and transgenerational trauma. So the transmission of trauma from one generation to the next, from mother to child. We often think of trauma happening in more of an environmental space. However, there's also a genetic basis for the transmission of trauma. Sometimes we think of our genetic code as fixed and unchangeable, but that's just not true. There's something called epigenetics, where the things in our environment, such as trauma, exposure to toxins, exposure to substances, can change our genes. It changes how they are turned on and off. And this leads to long-term changes in our physical brain structures and the pruning of our neurons. Trauma also affects social learning theory. If you think about a parent under stress and how that changes the way that they parent, how that changes the way that they interact with their child, and that stress is passed on to their child. Intrauterine exposure to stress is also very important. We know that when women experience stress during their pregnancy, and you look at their children, even into adulthood, that they have dysregulation in their HPA axis. And your HPA axis is your stress system, and it modulates your stress hormones such as cortisol. So these are changes long-term in how we deal with stress based on the environment we were in. Maternal ACEs in infant development are incredibly important. There are both physiologic as well as environmental factors. We know that pre- and postnatal depression, if left untreated, can lead to low birth weight, intrauterine growth restriction. It can lead to prematurity. And long-term, these lead to disease risks. There's also social and behavioral issues in terms of cognitive and emotional difficulties in children. So what do we do? You can say an ounce of prevention is worth a pound of cure. What is most important is that we focus on not just treating the symptom, but treating the cause. We need to focus more on early identification. There needs to be screening. We need to have screening in pediatricians' offices. We need to have multidisciplinary teams so that when you screen someone and there's at risk, you know where to send them. We need to have integrated clinics. We also need to treat substance abuse so that we're addressing ACEs as well. We need to screen for opiate use disorder and substance use disorder in pregnant women. And when we screen them, we need to do that in a way that is not stigmatizing, in a way that shows compassion and support. And we need to connect those women with resources. After birth, we need to empower the mother to care for her baby. We need to encourage rooming in and breastfeeding when it's appropriate. When you look at the ESC model, which is the Eat, Sleep, Console, it's a way to identify infants who are at risk of neonatal abstinence syndrome. And part of the identification is when you identify those infants is using non-pharmacological treatments first. A lot of that looks like swaddling the infant, keeping them in a low stimulus environment, and also having the parent there with them. Instead of removing these infants from their parents when they have neonatal abstinence syndrome, we need to empower the parent to care for them. We need to support that healthy attachment between the parent and their child. We need to better understand women during the peripartum period and how we can support them. That can look like in-home nursing support, classes, access to quality care for themselves and their babies, and time off of work.
So now you know a lot of information about adverse childhood experiences, about brain development, about moms and babies and families. So what can we do? Well, as a system, we can strengthen families. This is about providing support to kids, but also providing support to their parents. It's about maternal and paternal leave. It's about sick child daycare so people can show up to work and not have to worry about their children. It's about having facilities that moms can breastfeed at if they choose to do so, and really promoting family, even at work. It's also about supporting parents. It's hard to parent. I mean, I'm a doctor and parenting is the hardest job that I've done. So teaching parents is really important. Positive parenting classes, early interventions. If you have a mom that's pregnant and you know she's at risk, helping her and teaching her, as well as public education campaigns to get the message out there that what happens to our kids is important and that our interventions can have a meaningful impact in the course of their lives as adults. We also want to increase supports in school, early education is incredibly important. Sometimes school is the first place where these types of issues are identified. So being able to know what to look for and to intervene when you see something. Collaborating with physicians and other care providers is also incredibly important. Together, we can make a change. We need to shift the conversation from what the children and families are doing to what need is being met and why they're doing it. It's about informing people that there is a neurobiological change in the brain when people experience stress and trauma in early childhood. That trauma is passed down generationally from mom to children and on to their children. That the impact of trauma is chronic and long-lasting. Sometimes we see parents or caregivers who say, well, Johnny's just trying to make me mad, or he's doing that on purpose. And what we need to do is get people to understand, no, they're not. They are getting a need met, and meet them where they're at to help them meet that need. When we understand what is going on with these children and families, then we can start the process of healing, which is an incredible opportunity. We can provide trauma-informed, secure, stable, consistent environments for these children that can be healing and impact the course of their lives as adults. Here are some resources you can use. More information about the Adverse Childhood Experiences Study, substance abuse, maternal fetal care, or just about trauma in general. The biggest takeaway for me about this information is that what we used to look at as just the social stuff actually has an impact on the neurobiology and development of the brain. That those type of things like trauma and their environment impacts their physical health in a real biological way. And that we need to look at it that way because that intervention is going to affect their long-term health outcomes. That's what I think is really important. Danica, what do you think?
I think that prevention is so important. If we look at the parents and the mother while she's pregnant and supporting that caregiving unit, I think we can prevent ACEs from ever occurring.
Yeah.